Let's start by asking a question. Have you or someone you know ever experienced sudden weakness on one side of your body? If so, you're not alone. Many individuals, like Mr. Chen, have faced this debilitating condition. Modern medicine has made significant strides in addressing such health issues, but it often comes at a high cost. Moreover, communication gaps between medical departments, drug interactions, and the lack of a holistic approach can sometimes hinder effective treatment. Therefore, it's essential to consider an integrated approach, combining both traditional Chinese medicine and modern medical practices, as they complement each other rather than being mutually exclusive. Now, let's look at Mr. Chen's case. Name: Mr. Chen, age 44, occupation farmer. Mr. Chen's life that took a dramatic turn when he suffered a cerebral infarction. He found himself unable to extend his right arm, and his family's frustration grew as they struggled to care for him. In addition, skin issues led to discomfort in bed, causing further distress. The reasons behind his condition were attributed to a history of chronic alcohol consumption, a reckless lifestyle, and prolonged sleep deprivation. Our diagnosis process: Mr. Chen's symptoms were indicative of a common occurrence during cerebral infarctions. His right side displayed weakness, making it impossible for him to extend his arm, let alone lift it. His fingers clenched, rendering him incapable of holding objects, and his right leg stiffened, making movement extremely challenging. Daily self-care became unattainable, requiring specialized care for survival. The root cause was a cerebral vascular obstruction, commonly known as a brain stroke or cerebral infarction. This obstruction occurred within the cranial blood vessels, pressing against the neurons responsible for controlling right side limb movements, resulting in these hemiplegic symptoms. Our examination extended to the tongue, a crucial element in diagnosing cerebral infarctions. A stiff, immobile tongue or severe distortions indicated a cerebral infarction. If the tongue deviated to the left, it signified a vascular blockage on the right side of the brain. If it deviated to the right, it pointed to a vascular blockage on the left. A broad, stiff, and swollen tongue with difficulty in elevation signaled blockages on both sides of the brain. Our treatment plan: we employ wet cupping to address the atrophied muscles and promote detoxification. Bloodletting is utilized to address the cerebral infarction, improving blood flow to the affected areas. By integrating traditional Chinese medicine practices with modern medical approaches, we aim to provide Mr. Chen and others like him with a comprehensive and effective treatment plan for cerebral infarction and related health issues. Thank you for joining us in this informative session. Follow for more.